Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 12 practice NCLEX questions. Without delay, let's get started.
Police bring a client to the emergency department after she threatens to delete her ex-husband. She states emphatically, "The police should bring him in, not me. He's paranoid about my dating and has been stalking me for weeks. He's probably off his medicines. His case manager and the police won't do anything." In which order should the following nursing actions be done from first to last? 1. Ask about the marital problems leading to the divorce. 2. Assess the client's risk for harm to self and others. 3. Obtain the name of her ex-husband's case manager. 4. Interview the client about her current needs and situation. The correct order is 2, 4, 3, 1. The nurse should first assess the client's risk for harm, especially because the client could direct her anger toward her ex-husband or the nurse. Then it is important to know more about her current situation and her immediate needs. Obtaining information from the ex-husband's case manager might help clarify the risk of harm to the client. Problems leading to the divorce are less important than the situation following the divorce. A client who is neatly dressed and clutching a leather briefcase tightly in his arms scans the adult inpatient unit on his arrival at the hospital and backs away from the window. The client requests that the nurse move away from the window. The nurse recognizes that doing as the client requested is contraindicated for which of the following reasons? 1. The action will make the client feel that the nurse is humoring him. 2. The action indicates nonverbal agreement with the client's false ideas. 3. The client will then think that he will have his way when he wishes. 4. The nurse will be demonstrating a lack of composure over the situation. The correct answer is 2. The nurse's nonverbal behavior, moving away from the window as the client requests, indicates agreement with the client's false ideas. The client's behavior is likely to be reinforced if the nurse takes steps to agree with the false ideas the client holds. A young client diagnosed with paranoid schizophrenia is talking with a nurse. "You know, when I thought everyone was out to get me, I was staying in my apartment all the time. Now, I'd like to get out and do things again." What is the best initial response by the nurse? 1. With whom do you want to do things? 2. What activities did you enjoy in the past? 3. What kind of transportation do you use? 4. How much money can you spend? The correct answer is 2. Knowing the client's interests is the best place to begin to help the client re-socialize. Knowing with whom the client wishes to socialize, what transportation she has, or how much spending money she has may be relevant questions, but should be asked after the question concerning what activities the client enjoyed in the past. The nurse should do which of the following actions first when admitting a multigravida client at 36 weeks gestation with a probable diagnosis of abruptio placentae? 1. Prepare the client for a vaginal examination. 2. Obtain a brief history from the client. 3. Insert a large gauge intravenous catheter. 4. Prepare the client for an ultrasound scan. The correct answer is 3. Abruptio placentae is a medical emergency because the degree of hypovolemic shock may be out of proportion to visible blood loss. On admission, the nurse should plan to first insert a large gauge intravenous catheter for fluid replacement and oxygen by mask to decrease fetal anoxia. Vaginal examination usually is not performed on pregnant clients who are experiencing third trimester bleeding due to abruptio placentae because it can result in damage to placenta and further fetal anoxia. The client's history can be obtained once the client has been admitted and the intravenous line has been started. The goal is birth of the fetus, usually by emergency cesarean section. The nurse should also plan to monitor the client's vital signs and the fetal heart rate. Ultrasound is of limited use in the diagnosis of abruptio placentae. The primary health care provider prescribes whole blood replacement for a multigravida client with abruptio placentae. Before administering the intravenous blood product, the nurse should first 1. Validate client information and the blood product with another nurse. 2. Check the vital signs before transfusing over 5 to 6 hours. 3. Ask the client if she has ever had any allergies. 4. Administer 100 milliliters of 5% dextrose solution intravenously. The correct answer is 1. When administering blood replacement therapy, extreme caution is needed before administering any blood product. The nurse should validate the client information and the blood product with another nurse to prevent administration of the wrong blood transfusion. Although baseline vital signs are necessary, she should initiate the infusion of blood slowly for the first 10 to 15 minutes. Then, if there is no evidence of a reaction, she should adjust the rate of infusion to ensure that the blood product is infused over 2 to 4 hours. The nurse can ask the client if she has ever had a reaction to a blood product, but a general question about allergies may not elicit the most complete response about any reactions to blood product administration. Blood transfusions are typically given with intravenous normal saline solution, not dextro solutions. When caring for a multigravida client admitted to the hospital with vaginal bleeding at 38 weeks gestation, which of the following would the nurse anticipate administering intravenously if the client develops disseminated intravascular coagulation? 1. Ringer's lactate solution. 2. Fresh frozen platelets. 3. 5% dextro solution. 4. Warfarin sodium. The correct answer is 2. Treatment of DIC includes treating the causative factor, replacing maternal coagulation factors, and supporting physiologic functions. Intravenous infusions of whole blood, fresh frozen plasma, or platelets are used to replace depleted maternal coagulation factors. Although Ringer's lactate solution and 5% dextro solution may be used as intravenous fluid replacement, the client needs blood component therapy. Therefore, normal saline must be used. Intravenous heparin, not warfarin sodium, may be administered to halt the clotting cascade. The nurse is caring for a 22-year-old G2, P2 client who has disseminated intravascular coagulation after delivering a dead fetus. Which finding is the highest priority to report to the healthcare provider? 1. Activated partial thromboplastin time of 30 seconds. 2. Hemoglobin of 11.5 grams per deciliter. 3. Urinary output of 25 milliliters in the past hour. 4. Platelets at 149,000. The correct answer is 3. Urinary output of less than 30 milliliters per hour indicates renal compromise and would be the most important assessment finding to report to the healthcare provider. The APTT is within normal limits, and the hemoglobin is lower than value for an adult female, but within normal limits for a pregnant female. Although the platelet level is slightly low and may impact blood clotting when compared to renal failure, it is less important. A client presents to the OB triage unit with no prenatal care and painless bright red vaginal bleeding. Which interventions are most indicated? 1. Applying external fetal monitor and complete physical assessment. 2. Applying external fetal monitor and perform sterile vaginal exam. 3. Obtaining a fundal height physical assessment on the patient. 4. Obtaining fundal height and a sterile vaginal exam. The correct answer is 1. Bright red vaginal bleeding without contractions could indicate a placenta previa. A sterile vaginal exam should never be done on a woman with a known or suspected placenta previa. Applying the external fetal monitor will allow the nurse to assess fetal status. A complete physical assessment of the patient is indicated. A fundal height is used to monitor fetal growth during pregnancy, but does not provide information related to vaginal bleeding. After reinforcing the danger signs to report with gravida 2 client at 32 weeks gestation with an elevated blood pressure, which client statements would demonstrate her understanding of when to call the primary healthcare provider's office. Select all that apply. 1. If I get up in the morning and feel dizzy, even if the dizziness goes away. 2. If I see any bleeding, even if I have no pain. 3. If I have a pounding headache that doesn't go away. 4. If I notice the veins in my legs getting bigger. 5. If the leg cramps at night are waking me up. 6. If the baby seems to be more active than usual. The correct answers are 2, 3, and 6. Vaginal bleeding with or without pain could signify placenta previa or abruptio placentae. Continuous or pounding headache could indicate an elevated blood pressure and change in the strength or frequency of fetal movements could indicate that the fetus is in distress. Orthostatic hypotension can occur during pregnancy and can be alleviated by rising slowly. Leg veins may increase in size due to additional pressure from the increasing uterine size, while leg cramps may also occur and can commonly be decreased with calcium supplements. The nurse is reviewing the chart of a multigravida client at 39 weeks gestation with suspected HELLP syndrome. The nurse should notify the healthcare provider about which of the following test results. 1. Platelets 200,000. 2. Lactate dehydrogenase greater than 200 units per liter. 3. Uric acid 3 milligrams per deciliter. 4. Aspartate aminotransferase 15 units per liter. The correct answer is 2. The normal value of LDH in a non-pregnant person is 45 to 90 units per liter. LDH elevations indicate tissue destruction that can occur with HELLP syndrome. This platelet range is in the normal range and remains unchanged during pregnancy. Uric acid in a non-pregnant woman is 2 to 6.6 milligrams per deciliter. AST normal range is 4 to 20 units per liter. Following an eclamptic seizure, the nurse should assess the client for which of the following? 1. Polyuria. 2. Facial flushing. 3. Hypotension. 4. Uterine contractions. The correct answer is 4. After an eclamptic seizure, the client commonly falls into a deep sleep or coma. The nurse must continually monitor the client for signs of impending labor. Because the client will not be able to verbalize that contractions are occurring, oliguria is more common than polyuria after an eclamptic seizure. Facial flushing is not common unless it is caused by a reaction to a medication. Typically, the client remains hypertensive unless medications such as magnesium sulfate, are administered. A premigravida client with severe preeclampsia exhibits hyperactive, very brisk patellar reflexes with 2 beats of ankle clonus present. The nurse documents the patellar reflexes as which of the following? 1, 1 plus, 2, 2 plus, 3, 3 plus, 4, 4 plus. The correct answer is 4. These findings will be documented as 4 plus. 1 plus indicates a diminished response. 2 plus indicates a normal response. 3 plus indicates a response that is brisker than average but not abnormal. Mild clonus is said to be present when there are 2 movements.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.